Many of us have heard of diabetes. This is a very short and sweet breakdown of the basics of this otherwise complex disease. Simply said, diabetes is about three things working together: blood sugar, insulin, and muscle. There are two types of diabetes, type 1 and type 2. Most people, in fact, 90 to 95% of people have this type 2. This is how things should work. Blood sugar uses insulin as the key to get inside the muscle. In type 1 diabetes, there is no insulin. There's no key, nothing to help blood sugar unlock the door to get into the muscle. In type 2 diabetes, there is insulin. However, the lock is gummed up with intramyocellular lipid, aka fat. Blood sugar cannot get into the muscle because the lock is gummed up. This is insulin resistance. Something is resisting the insulin from going where it's supposed to go. The more fat that is blocking the keyhole, the harder it will be to get rid of it. If the blood sugar can't get into the muscle, it builds up in your bloodstream. The more fat that blocks the door, the harder the insulin has to work to get in. The insulin is gray here to represent there's now likely a problem with the quality and amount of insulin. If the sugar hangs out long enough in the bloodstream, you'll be diagnosed with type 2 diabetes. The first line of attacking type 2 diabetes is diet and exercise. Eating less fat and sugar means there's less in your system for the body to have to process. Exercise burns fat and sugar, again reducing the amount of fat and sugar in your body. If you eat a healthy diet and are exercising, you'll improve your overall health and possibly lose weight, allowing all of the body systems to work more efficiently. If diet and exercise are not enough, the first medical line of defense is usually an oral prescription of metformin. Some of the trade names for metformin are Glucophage, Fortamet, Riomet, or Glumetza. The reason metformin is often tried first is that it's safe, effective, and affordable. This is your liver. If you eat more sugar than the body needs, it will be stored in the liver. The liver then releases it when you need it. Metformin helps block the sugar your liver releases from getting into your bloodstream. Metformin doesn't immediately lower your blood sugar. It can take 4 to 5 days to experience the full benefit, depending on your dosage. In type 1 diabetes, there is no insulin, or very little. There is nothing to unlock the door. All type 1 diabetics need to replace the insulin. Some type 2 diabetics do not have enough insulin, or the insulin they do produce is poor quality. If that happens, type 2 diabetics also use insulin. There are three main categories of insulin: fast-acting, intermediate-acting, and long-acting. Unlike oral medications, insulins can drop the blood sugar levels very quickly. You need skills to use insulin safely. Currently, there is no cure for diabetes. That said, research is always on the move in that direction, with new treatments continually coming out on the market. There are weekly injectables like Ozempic and Trulicity for type 2 diabetes, or Tzield for type 1. There are also new types of insulin pumps and electronic monitors. Prevention is key. There are many things you can do to prevent or delay the development of type 2 diabetes. All of the images used in this presentation are free use and taken from the website providers as indicated. The information here is purely educational and not medical advice. Please talk to your medical provider about treatment options that are best for you.